Tonight's top stories and weather before the first commercial break. This is Local 12 News, live at 11.
And some women swear by Botox for keeping a youthful look, but doctors warn black market versions can put your health in danger. How you can spot a fake.
It's now the #1 non-surgical cosmetic procedure in the world, but local doctors have an important warning tonight about Botox. As the demand for the wrinkle reducer goes up, so does the supply of black market Botox. Local 12's Liz Bonus has details in tonight's Medical Edge.
No shot in the dark here. Julie Mandell trusts the supply and the supplier. Her brother-in-law, Mark Mandell-Brown, is also a facial plastic surgeon. You see, as the demand for Botox has grown, so have the knockoffs.
But there is black market Botox, and periodically it gets out on the market and you get some bad side effects.
Side effects like those you may recall from a recent botched Botox case in Florida.
Somebody got a hold of Botox that was really designated for animal research. It was about 1,000 times more potent than the human form of Botox, and 4 people ended up on ventilators because not only did they relax or paralyze the muscles on their face, they paralyzed their respiratory muscles, and they ended up being in the intensive care unit for about 3 or 4 days.
Mandell-Brown recently set out to learn more about the odds of something like this happening again. In other words, what kind of Botox standards are maintained by those who treat patients?
So to find this out, he sent out a survey to more than 500 physician offices that used Botox nationwide. He wanted to find out where you get your Botox from, how you use it, how much you use, and how it's stored.
Mandell-Brown recently presented the answers to his survey at a World Congress sponsored by the American Academy of Cosmetic Surgery. He got more than 100 responses and found there were very few standard answers. So if you're considering Botox, he suggests you ask many of the same questions he asked in the survey. For example, who is the Botox supplier? In the U.S., Allergan is the only legitimate supplier. A special hologram on the label tells you it's not a knockoff. Second, how is your doctor using Botox? It's approved for use by the Food and Drug Administration to reduce furrowed brow lines, but many physicians also use it to stop everything from excessive sweating to migraine headaches. Third, how is the Botox stored? Once it's mixed, it should be used within 4 hours. And finally, what is the dilution and how many units are being injected into each area? This can make a big difference in results.
In general, it should start working within 3 or 4 days, and it should last typically about 3 months.
By the way, this simple shot most of us get because
when you get older, you want to hide your wrinkles.
In his survey, averaged anywhere from $150 to $400 per area. With your Medical Edge, Liz Bonus, Local 12.
Well, since this is only a survey, more clinical trials are needed on cost, effectiveness, and other appropriate uses for Botox. The side effects in most cases are bruising.